You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J. Tassoni Jr., with today's guest.
Welcome to Recovery TV, and I'm your host, John Tassoni. My guest today is Miss Michelle Harder, and she is with Anchor Recovery. Welcome, Michelle, and thank you for joining us.
Thank you for having me, John.
So I want you to explain to my viewers about Michelle Harder.
Oh, Michelle's Harder is a lot of things. First and foremost, I'm a woman in long-term recovery, and for me that means that I haven't felt the need to imbibe in drugs or alcohol or cigarettes in a pretty long time, July 5th, 1994. So
I got to ask you this question.
Yeah.
Every person that I interview with substance abuse has been in long-term recovery remembers that date like it's been tattooed on their arm. Why is that?
I had a spiritual experience that day. No word of a lie. I remember sitting on the couch in my house at 8:30 in the morning with a glass of vodka and looking across the street and saying, wow, I think I really need to get some new glasses because I can't see across the street. And I thought, that's a weird thing to say. And I felt a presence. And I heard the words, you don't deserve to live like this anymore. That was it. That was it. And from that day forward, everything changed, even down to, I'll tell you a very quick story. My husband, who was my boyfriend then, and I were living together with my two children, and he was ready to have me removed from the house and have my parents come and pick up my two kids. They were 8 and 11 then. They're 37 and 40 now, but while he was at his mom's house on the phone with my parents, I was at our house on the phone with Talbot House, which doesn't exist anymore, unfortunately. Talbot House, strangely enough, had a bed available. And when he walked in the door to tell me that I need to leave, he said, what are you doing? And I said, I want you to take me to Talbot House. This all happened in that same day.
Wow.
So I believe that there was some divine intervention that went on, and I don't ever forget that day. That day is more important to me than my birthday. And my family knows that.
Yeah.
That's the day my life changed.
Yeah. That's unbelievable.
Yeah, I mean, it's when I think about it today, and I'm extremely grateful, I can actually feel that feeling again. And I hear it when people talk. You know, you can see the light. You know, maybe the light switch when you're talking to somebody, coaching somebody, you see that light go on in their eyes and they, oh, wow, that makes sense to me, you know. If she can do it, so can I. That light bulb moment. You know?
So the light bulb moment that you have, what made you go into helping people?
Well, before this, in my former life, I was a paralegal. I had been a paralegal and working for lawyers since I was 14. I always wanted to be an attorney. I always knew I wanted to be an attorney. Things happened in my life that prevented that. I got married. I had 2 children. I got divorced. And I think I was always in a helping role. I worked with people that had to file bankruptcy or were going through a divorce. So I always found myself in that role. And after my dad died 11 years ago, I took a leave of absence from work. And I just what am I going to do with my life, you know? Because I knew I didn't want to do that anymore. I didn't want to listen to people whine about, you know, who's going to get the cat, you or me, you know? And so it really was a defining moment for me after my dad passed. You know, they say your life changes when a parent, you know, passes away. I know that to be true. And somebody said to me, why don't you go volunteer at this place called Anchor Recovery, and I'm like, you know.
Yeah.
And one day I just found myself there. I talked to a guy named Jimmy Plant, who now works, I think, at Phoenix House, or Zinnia, and I just met Jimmy Gillen, and my life changed. Like, my life changed. And he walked up to me and he said, "I heard you know some things about trauma with women." And I said, "I do." And he said, "I want you to do a group." Okay. And that's where it started. And myself and George O'Toole were the first recovery coaches in Anchor. You know, that really, and Holly Sakala too. I shouldn't leave out Holly Sakala, who, you know, came in and taught me all I know, you know. So it was me and Jimmy and Holly and George and some volunteers. And there it went. And I haven't left since. I left for a little while, a little bit too stressful, as this profession sometimes is.
Yep.
And went and started a program up in Burrillville Addiction Assistance Program. And my heart brought me back to Anchor again, you know.
So tell me about Anchor.
So Anchor has been around since 2010. Was the brainchild of a guy by the name of Jimmy Gillen, and the Providence Center, a guy by the name of Dale Claxter, who has moved on to other ventures. But the Providence Center really believed in what Jimmy's thoughts and what Jimmy's mission was in his head, and it worked, man. It was crazy. If you could have seen the people that would walk in there on a daily basis trying to find like-minded people to sit and just shoot the breeze with, it was amazing. It was amazing. And people would get off the bus in Pawtucket, they'd walk up the street, they'd come in, have a cup of coffee, sometimes we'd have cookies there, you know, and they could meet with a recovery coach, they could go to a training, they could utilize a computer for no charge, they could read, you know, they could hang out all day, and people felt comfortable there, you know. I remember Jimmy saying in a Faces and Voices video way back when, that the place had a vibe, and it still does, you know. It's where like-minded people with a problem can go just feel like they're a part of something. And we still try to honor that mission today.
You know, and the way the world is going today, which is
It's a rough place, right?
A rough place right now. Are you seeing an uptick in people who are visiting?
So I will tell you that since COVID, it's like a dirty word now, you know. Since COVID, our in-person has dropped off. I think people are afraid. They're afraid to congregate, you know, in places. And I also think that Zoom meetings have, you know, increased the ability for people to attend a meeting at home, you know. We have, on the other side of it, the telephone supports has skyrocketed. So we're on the phone with people every single day. A lot of people. We're starting to see things pick up right now, and we're hoping that with the summer coming and beautiful day like today, that people will start to come out of their house. I'm a great believer. Zoom works. It still allows you to connect. But you miss this. You know, there's someone sitting in front of you instead of looking into the screen.
Yeah.
You know?
We're going to take a quick break. I want to talk a little bit more about that when we come back. You've been watching Recovery TV, and I'm your host, John Tassoni. We're here with Michelle Harder from Anchor Recovery, and we'll be right back after this.
You know, every week I work in stadiums filled with thousands and talk to thousands more on the radio, which means people who come from every walk of life. And I know that many, like my own family, have grieved over loved ones caught in the grip of addiction. 8 years ago, we lost my nephew to an overdose. But I've also seen in friends and even fans who've shared their stories, others break that hold and regain control of their lives. You can do the same. Please know you're not alone.
Anchor Recovery has been a mainstay since 2010 and was the first recovery community center in the state. Anchor Recovery has grown from just a couple of 12-step meetings to an entire cadre of meetings supporting multiple pathways of recovery. Today, we support medicated assisted treatment, mindfulness, meditation, yoga, and physical aspects of recovery. Easy access in 3 locations. Learn about how recovery can help you. Different paths, same destination. Stop in, call, or visit anchorrecovery.providencecenter.org.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And will give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV. I'm your host, John Tassoni. Michelle Harder is my guest today, and Michelle is with Anchor Recovery. So, Michelle, thank you for joining us today and taking time out of your busy schedule.
Thank you again.
So, Anchor Recovery. Is it just for adults? Is it for adolescents? Is it for babies? What is it?
Not for babies. Boy, I hope we never have to have something like that for babies.
Me too.
Women and Infants does a great deal with, substance use affected newborns.
Right.
Teens, we do have the Jim Gillen Teen Center, and we have to deal with teens a little bit differently than we do with adults. And we don't want to, having that interaction. We want people to be able to associate with people that look like them and talk like them. So we have a specific program just for teens. That's on North Main Street, 1280 North Main Street in Providence, right on the bus line. And they have a wonderful recording studio there, and there's some really talented kids in this world of recovery that are affected by substance use, either their own or their families. So we cater to that in conjunction with the Anchor Recovery High School.
That Anchor Recovery High School was my idea in the General Assembly. So
well, there you go.
I don't want to pat myself on the back, but I did a damn good job.
You did.
But my point is, too, that I think one of the things that concerns me is that we don't have enough of it. We don't have enough adolescent treatment / care here in Rhode Island. A lot of our kids that live here in Rhode Island that have issues have to go out of state. And my pet peeve has been all along to try to get a facility in Rhode Island back, like Phoenix House had years ago, and a few
Corkery
others.
House and Neil,
Yep.
Yeah.
Because there's no family intervention if you have to go to Maine.
Right.
Because the people don't have the means to get to Maine. Most of our kids that have issues, most, not all, most, are from the inner city.
Mm-hmm.
And when you have people that don't have a car and need to use the bus line to get to work and get their kids to treatment, the buses in Ripton, they don't go to Maine, New Hampshire, Vermont, or Connecticut.
No.
So we need
They don't go to Burrillville.
That's true, but we need to educate. We need to educate our leaders here in Rhode Island, and I've been trying to do that for the past 5 years that I've been here, but hopefully this year they're really talking about doing something. I was on a conference the other day about building a building in the Pastori complex, and I kept pushing for adolescent care in that particular building, if in fact we build it. So, things are headed in the right direction. But as far as Anchor Recovery, how many sites do you have?
So we have 2 sites now. We have one in Warwick on 890 Centerville Road. It's really what I refer to as the easier, softer Anchor. It's a ranch house on the grounds of the YMCA.
Oh, nice.
Really nice, comfortable, warm place. We're also located in Providence in our brand new building. I should say brand new. It's been almost a year. Actually, it's been over a year since we've been there. A year ago, last October. I think with COVID, everything just becomes like one day.
Right.
We've been there and open, and all through COVID, we're open.
So you're not in Pawtucket anymore?
We're not in Pawtucket anymore. We do a lot of outreach in Pawtucket, as other agencies do. There's a really high need in Pawtucket, and sometimes more so than like your 02903 or 02907 zip codes, which we tend to concentrate on. It's bad everywhere, John.
You say that, and people don't even realize. I mean, I was on a conference call with the Smithfield people the other day, and about, our fire chief was telling us that it was 3 to 5 runs a week with overdoses. We've had a number of deaths too in Smithfield.
And so you've got the safe stations up there now.
Exactly.
Yeah.
I worked very hard to try to get that and convince people that it was the right thing to do, but ultimately they saw the light per se, and they put the light on, and people are home now. So if you need to get into treatment or you need to talk to somebody, we have the people.
There is a lot of closed-door addiction in this state.
Oh, no doubt.
A lot of closed-door addiction. I found that out when I was developing the program in Burrillville, that people are using behind very expensive front doors, and you would never know it until something happens. So I'm really grateful to you that you've done that safe station in Smithfield. I live up in that northwest corner of the state. There's a lot of things happening up there. We're trying to form a recovery center up there in conjunction with one of the pathways of recovery, fitness, and we're hoping, that it's growing. It's crazy. I run a women's meeting there on Tuesday nights that gets bigger and bigger every week. So the need is everywhere.
Yeah, everywhere.
It's everywhere.
Right.
And, you were talking about the youth earlier. Anchor is just starting with a grant from the federal government to train people that are interested in recovery coaching and being a peer to youth, 17 to 25, 26 years old. We're hoping to get an endorsement from the Rhode Island Certification Board for a youth certified peer recovery specialist. This will be, a new training. I know Parent Support Network is also training youth. We're just trying to get where the need is. And it just seems like, sometimes you're shoveling against that tide, And
well, it's like everything else. You open a door, and the next door you have to open, and the next door you have to open, and and I know, a lot of people today I got to get their heads out of the sand. There's no more ostriches about this issue.
I think education is hugely important in that. If we don't educate the community, the general public, about what a public health crisis we have, it's not just an opioid epidemic.
I'm glad you bring that up, because if 10,000 people all of a sudden got diabetes, all right, in a matter of weeks, the red flag would go up.
You bet.
All right, and they would send people in right away to get it done.
Yep.
We got 400 people dying last year, and we have an enormous amount of people in treatment.
Yep.
We don't have beds available, we don't have access available, and the whole bit. And no one seems to want to get it. And I'm going to take a break, and then we're going to talk about that when we come back.
Okay.
You've been watching Recovery TV, and I'm your host, John Tassoni. Michelle Harder is here from Anchor Recovery, and we'll be right back after this.
I think when you're actively struggling with an addiction, you don't realize the harm that it's causing to the people in your circle, in your family, and your friends. By quitting and getting help, I was able to heal a lot of relationships that were damaged, and you find that people come back to you Someone used to say to me that it's darkest just before dawn. So if you think that you've gone too far, it's not true. No matter what problems you have, your life can get better if you get help.
Sometimes everyone can use a helping hand. At Tri-County Community Action Agency, we offer support services when you need it the most. From food and heating assistance to family health and dental care, we have programs to lend a helping hand throughout the whole life cycle. From grandkids to grandmas, individuals or families. If you or someone you know could use a helping hand, visit our website at tricountryri.org to learn more about the many services we provide. We know it isn't easy to ask for help. At Tri-County, we are here when you need us. For more information, visit tricountryri.org or call 401-351-2750.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodak.
The Rhode Island Department of Health reports that drug overdose death is the #1 cause of accidental death in our state. Zinnia Exeter is committed to helping overcome addiction and the silent epidemic of drug overdose. Our substance abuse completion rates are over 25% higher than the national average. If you or a loved one is struggling with addiction, call Zinnia Exeter to learn about treatment options.
With these,
and this,
with my mouth shut,
and my ears wide open,
it means that from the moment you walk into the room,
you're the most important patient to me.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Michelle Harder's in the house, and Michelle is a person in long-term recovery, and she also works for the Anchor Recovery organization. So, Michelle, thank you for joining us.
Thank you, John.
Thank you for what you do.
Thank you. And thank you for what you do.
And thank you for my mission. It's a voice of hope.
The voice of hope.
Because there is hope.
Yeah, there is hope every day.
So, I want to talk a little bit about Anchor as far as what your vision is moving forward. I know we talked about expansion, so tell me your vision.
So my vision is that we could have little anchors everywhere, you know. I think that Rhode Island has adopted such a great plan to be able to provide what we need across the state geographically. I really think that we need to let people know that addiction is a family disease, and we need to treat the whole family. You know, that's my mission, is to get family recovery on board and say, you know what, your son, your daughter, your mom, your dad can find recovery, and you can find recovery from the trauma that you've been through. That's my mission.
So if people want to either donate, either want to get involved, how do they go about doing it?
So they can go to our website at anchorrecovery.org. There is a donate button there. All the information that you'd ever want to know about Anchor, how we started, where we are now, all the trainings that we offer, which are significant. You want to learn how to be a peer recovery specialist, we're the ones you want to come to. Schedules of meetings, what it's on Zoom, what's not, what's online, what's in person, and call us, 401-889-5770.
Well, you know, Michelle, I want to wish you luck with Anchor Recovery. I want to thank you for what you do. I want you to thank you for being a sponsor now in 2022. You know, and you really hit the nail on the head as far as getting the word out, communicate. you know, the stigma has got to stop. 1 in 2 families now are dealing with addiction and substance use and mental health issues. So with your help, I like the team that we're putting together now, that we can eradicate this. We're not gonna save everybody.
You
know,
can't.
one person at a time, so.
Just one
again,
person.
Thank you, thank Anchor Recovery. I really appreciate you coming on, and love to have you come back on again.
Thank you, sir. I would
Right.
love that.
All right, thank you. You've been watching Recovery TV, and I'm your host, John Tassoni. This is a voice of hope right here. And we'll be back next week.
My first experience with addiction was actually with a family member. And I was very young at the time. I didn't really understand everything that was going on. But I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone. But I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You know, you can make it through this. You can get back on track.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
Addiction Recovery Institute, with locations in Pawtucket and Warwick, have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231. The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
Tune in every weekend for a new edition of Recovery TV. Host John J. Tassoni Jr. discusses information on addiction and mental health issues with local leaders in today's recovery world. Tune in Saturday evenings on MyRI TV or Sunday mornings on CW Providence or Fox Providence.